And welcome to the Dr. Bob Show. When you see your doctor, does he order tests? Do you know what those tests mean? Do you know if they're important? Could they save your life? We'll be spending most of this show talking about tests your doctor orders that could save your life. My guest is Dr. Michael Bernard. Dr. Bernard is a board-certified internal medicine specialist, a diagnostician. He'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show. Later on, we'll be talking about the difference between dizziness and vertigo. Is there a difference? What is the cause of vertigo and how can we get rid of it? A lot of information for you. You'll want to stay tuned. We're talking with Dr. Michael Bernard, board-certified internal medicine specialist, that's a diagnostician, and we're going to be talking about tests that could save your life. Mike, welcome to the Dr. Bob Show.
Glad to be here.
And most patients that come in for their first visit, do you end up getting some tests?
Oh, we do.
Let's talk about some routine ones. There's a word called CBC. What's a CBC?
Yeah, complete blood count.
Complete blood count. Now, what does that mean and how does it help people?
Well, what we're looking at with the complete blood count is we're looking at white blood cells, red blood cells, and platelets.
Okay, when we look at red blood cells, let's talk about those for a minute. What are red blood cells, what do they do, and what's the name of the test?
Well, what we're really looking at with the red blood cells are the ability of the body to carry oxygen to the organs that need them, the brain, the heart, all the organs. And we use two different numbers. We use hemoglobin and hematocrit.
Either one of them more important or together they're important?
They're together important. Hemoglobin is the protein that carries oxygen. And hematocrit is when you spin down the blood, we look at how much of that blood is red blood cells able to carry oxygen to the brain. And so we look at them together.
If somebody has a low hemoglobin and a low hematocrit, not enough red blood cells, what do you call that?
We call it anemia.
And if they've got anemia, then can that help save somebody's life?
If we find out they have anemia, we've got to find out why. And then once we find out why, then we can save their life.
What are some of the causes of anemia?
Well, we have iron deficiency anemia. And when we have iron deficiency anemia, you're losing iron, you're losing blood someplace. So common causes would be through the stomach tract.
So stomach bleeding, GI bleeding from the stomach or the colon or from
That's right. And it could be something as benign as a blood vessel that's bleeding, or it could be something more serious like an ulcer or colon cancer.
So does cancer cause anemia just by bleeding? Is it by blood loss?
That's one of the ways. The other way that you can become anemic is if the bone marrow stops working, and if your body is so sick that your body just quits making red blood cells.
So the bone marrow quits working. Now, what does the bone marrow do as far as red blood cells go?
Yeah, well, that's where your red blood cells are made.
That's a factory?
It kicks them out, you know, and it's kicking them out continuously. And so if you have an illness in your body that's overwhelming your body, such as a cancer or kidney disease, then your bone marrow will quit working and your red blood cells will go down.
When somebody has an anemia, what do you have to do to find the cause? Can you look for them with other tests?
Yeah, we look at the size of the red blood cells.
So a little bitty red blood cell with a little bit of hemoglobin would mean somebody's had blood loss?
That's right. That's an iron deficiency.
And what if it's a big old blood? Do you ever have a big red blood cell?
We do. You know, common causes would be B12 deficiency, or maybe you're drinking a little too much, something along those lines.
So it clues you in, and then you can help the patient. Do you have to just give them iron before you find the cause? Or you find the cause and then give them, then treat?
We find the cause, unless you're very anemic, in which case we find the cause while we're giving you blood.
Good. So that's the hemoglobin, hematocrit. Now in the CBC, there are white blood cells, you said. What do white blood cells do?
Yeah, well, white blood cells are the cells that fight infection.
So that's part of what we call the immune system.
The immune system.
If that white blood cell gets too high, what does that indicate?
Well, it usually indicates either infection or it could indicate that you have another process that's causing inflammation in the body. such as a cancer or other types of inflammation.
So it really, if it gets high, it's a warning sign something's going on. What about a low count? If your white blood cell count is low, does that indicate certain type of infection?
It could. It could indicate a very overwhelming infection, or it could also indicate that your bone marrow is no longer working.
So that white blood cell count really gives you a lot of information. A leukemia like chronic lymphocytic leukemia, will white count be high or low?
It'll go up high.
Go up real high, doesn't it?
That's right.
Somebody has a viral infection, what does the white count do?
Well, usually the white count will go up. Occasionally it can go down. If you have a viral infection, we look at the type of white blood cells.
Is there a certain white blood cell in a viral infection?
So we tend to see granulocytes with bacterial infections and more lymphocytic cells. So when you look at the white blood cells, you can look underneath a microscope and determine what type of white blood cell it is.
That must be neat to get a little drop of blood and be able to tell if you think most likely the patient has bacterial, viral infection, leukemia, blood loss, anemia. The other cells that are in that white blood cell count, we've talked about the neutrophils, that's the white, normally what we call the white cell. How about the eosinophil? What is that?
Eosinophils look more allergic type reactions.
So it can give you a hint if there's an allergy reaction like that. So the differential is important too. So the CBC can save somebody's life. Let's switch to another test that should be done every time you come to a doctor's office. Blood pressure. Tell me about the blood pressure.
Well, blood pressure I consider to be an overall register of how your body's doing. It's a measure of the peak of your blood pressure when your heart squeezes, called systole, and then when your heart has the lowest blood pressure, that's called diastole.
So tell me, what are the normal numbers?
Well, normal would be 120/80 in most people.
Is that a pretty good number to follow?
That's a good number for most people. That's where most people should be.
So 120/80. So if either number goes high or just one number goes high, you've got high blood pressure.
If either number goes high, you have high blood pressure.
You have to treat that.
So you should be treating it through diet, exercise, lifestyle changes.
Do those really help?
So they help.
Yeah, they help a whole lot.
Absolutely.
I think sometimes we don't want to pay the price that it takes to get our health good.
That's right. I always tell my patients, look, I don't want you on any medications. And if you're dieting properly, you're exercising properly, hopefully you won't be on any. But when either due to genetic causes or we're not taking care of ourselves or environmental causes, sometimes we do have to use medications. And certainly once your blood pressure gets to be above 140 systolic or 90 diastolic, for most people, then we start to consider, okay, should we use medications?
Do you have good medicines?
We have very good medications.
Do you have the patient take their blood pressures at home? Does that help you? Or is that?
Well, a lot of times when people come to see me, they think, my goodness, what is he going to tell me? The blood pressure goes up. And we don't go just on that one reading. So we'll tell them to come back in a few weeks and check again. And if it's still high, I'll tell them to go home, take a few readings at home. When you're in your own environment, when you're relaxed, there's not any stress going on. And let's see what your blood pressure is there.
The risks of not treating a high blood pressure would be what illnesses?
Well, heart disease, strokes, kidney disease, peripheral vascular disease where your blood flow doesn't get to your legs.
Let's look at a patient that had a test ordered by their doctor that could have saved their life. We're talking with Bob Calloway. And Bob, you have an elevated cholesterol. How did you find that out the first time?
Simply through my annual physical exam with my doctor.
And he got blood work and told you your cholesterol real high or moderately?
Well, it was in the 230, 240 range, which bothered him. But we agreed that I would try to exercise and watch my diet, and he would not prescribe any medication at that time.
Now, I know you as a friend, and you're a pretty regimented guy. So you exercised regular, you ate food properly. What did that do to your cholesterol?
For a while, it was okay. It stayed in the 220, 240 range, but as I got older, it was harder to keep it within that range. And finally, my doctor said, you're at the age where your body is offsetting the benefits of the exercise and good diet you need to go on medication.
And so you started on medications. Did you tolerate them well?
Very well.
And did your cholesterol come down?
It absolutely did.
How does it make you feel to know that your cholesterol is in a normal value and that you don't have to worry about high cholesterol?
It is such a relief because I fought that battle for so long, and it was a slowly losing battle. Now, I haven't given up exercise, and I still watch my diet, but to be in the 180 to 175 category is a huge blessing for me.
Yeah, and the literature says that that should make you a healthier and happier guy. And how do you do on that? Are you healthy and happy?
Well, I think so. I feel good, and when I go to get that physical and have that cholesterol number come in, I've got confidence that it's going to be a good number.
And your blood pressure has been?
Blood pressure has been steady and normal the whole time.
And your weight's been good and stable?
No problem.
Bob Calloway, you're an ideal person. You had your routine blood work. When it was elevated, you did something about it. When you needed medicines, you started that. You're going to do well. Thank you so much for coming to the Dr. Bob
It's been
Show.
a pleasure. Thank you.
We're talking with Dr. Michael Bernard, board-certified internal medicine specialist, diagnostician. We've been talking about a CBC, hemoglobin, hematocrit, anemia, white blood cell count, infection, viral, bacteria, can have leukemia. They give you information that could save your life. Blood pressure, if you get it under control, it may prevent you from having heart attacks and strokes. So pay attention to those things when you see your doctor. Mike, let's talk about colonoscopy. Is that a test that everybody should have, or at what age should they start?
Well, everybody should have them from age 50 on. And then there are certain populations of people who should have them earlier than that.
Okay, so let's talk about at age 50. Why does a person need colonoscopy? What can it do?
Well, colonoscopy saves people's lives. I had 3 patients in 1 week who had colonoscopies where they found colon cancer at a very early stage, where literally the surgeon just went in and removed a very small part of the colon, and those people have lived, they're healthy, and without that colonoscopy, those people would have died. They would have had cancer that spread, and they'd be dead now.
So wow, that's
In 1 week.
In 1 week, yeah.
So that's
Now, if they find a polyp,
that's the best case scenario. You find the polyp and you remove it before it moves on to colon cancer.
so do polyps, are they precancerous in the colon?
Yeah, certain types, adenomatous polyps, they grow, not all of them, 5% or so, they will progress on to colon cancer.
Now, if they progress on to, how long will it take for that polyp to go? A couple of months or a couple of years?
Well,
Or?
it's usually a couple years, and it depends on how big the polyp is and how aggressive the polyp is.
So when you have colonoscopy, if there is a polyp, can it be removed, or you have to call the surgeon? And,
You just grab it with some forceps right there in the colonoscopy and you're done. I mean, it's literally, they see the polyp, they grab the polyp, they pull it off, and it's gone.
now, when you have a polyp, does that mean you can wait 10 years to have your next colonoscopy, or you have to have it again more frequent?
Yeah, if you have an adenomatous polyp, you should probably have it within 3 years. If it's very aggressive, if it's a flat polyp, maybe come back in a year and look again. But generally, 3 years.
Now, if you have a colonoscopy and the doctor says, clean as a whistle, see, you don't have any polyps, didn't have any cancer, didn't have anything, good, I never have to come back again, or you have to come back again?
Come back again every 10 years.
Okay, so that's 50, 60, 70?
70. And if you're doing great, if you're healthy, go back again at 80. Most people don't do them past 85.
Yeah, so I'm 95 right now, so I don't need any more.
You're holding up well.
Back to the colonoscopy. There's about 150,000 cases of colon cancer every year, and it's just as important in men as women. So do you tell women to have colonoscopy too?
We do. We tell women
and-
to have them just like men.
So, now, you mentioned certain circumstances before age 50. What circumstances?
Absolutely. If you have a first-degree relative who has colon cancer, so your mother, father, brother, then you should have it done earlier. You should generally, if they had colon cancer at age 50, you'd want to have your colonoscopy at age 40.
Okay, so earlier than the first line relative, you go a little bit earlier than they do.
That's right. Also, if you have 2 second-degree relatives, you'd also want to get your colonoscopy early.
Good. So very important, colonoscopy can save your life.
Absolutely.
Let's go to another test. It's called a routine blood work that you frequently get. It's called a metabolic profile comprehensive blood work. What do you all call it at your lab?
Yeah, we call it a comprehensive
Now,
metabolic profile.
that will have a blood sugar. Tell me about a blood sugar. What does it tell you? Should it be fasting? That means without food, or should it be any time during the day?
It should be fasting. And what we're looking for primarily is diabetes. Diabetes is a condition where your blood sugar is too high, causes lots of problems with your heart, with your brain, kidneys, nerves.
Now we're seeing more and more diabetes, type 1 and type 2. One, you need insulin, and the other one, you probably don't need insulin because of obesity.
Obesity.
So if somebody's overweight, does it make you start thinking about better get that metabolic profile?
It does. I mean, certainly obesity is a major factor for developing diabetes, and we want those people to be working on diet and exercise. But if they do develop diabetes, we want to catch it as early as possible.
So if the blood sugar is there a certain level that makes you think, yep, they've got diabetes, or just, if it's high, it'll tell us that?
125 is, above 125 is considered diabetes. If you came in, your blood sugar is 125, we'd ask you to diet and exercise. We'd repeat it again. And if it comes back again at greater than 125, then you'd have a diagnosis of type 2 diabetes.
Have you ever seen anybody who was overweight and you had them exercise, you had them eat right, that their blood sugar came from 170 down to normal after a period of 4 to 6 months, something like that?
I have. It's a great experience.
That must be wonderful. No, you don't have to take a pill, that you can take care of yourself. You're responsible for your health. That's your blood sugar. Now, if I told you a test was a BUN and a creatinine, what organ does that look for?
Yeah, those are looking at your kidney function.
So we've got blood sugar, looking at diabetes. We've got a kidney function. That's BUN and creatinine. Does everybody have a BUN and creatinine?
They do.
And so you look for elevated levels?
We do. We look for elevated levels, and a lot of times what we're looking for are mild elevations in your BUN and creatinine, which would indicate early kidney disease. In those situations, we want to find out what's causing it. A lot of times it's high blood pressure, and in those situations, we really want to work hard on getting that blood pressure down.
Can people have a high blood pressure and not really know it? Or can you feel your head exploding? I know I've got high blood pressure.
Yeah, it's called the silent killer because it's silent. People don't know they have it. Now, when somebody comes in, they have a headache or they feel bad, a lot of times their blood pressure will be elevated, but that's because they feel bad. It's not because their blood pressure's causing the elevated.
Back to that blood work, comprehensive profile, metabolic profile, liver function tests. Are there tests that will tell you if your liver's healthy or not?
There are the AST, ALT.
And if they're elevated, what does that mean as far as the liver goes?
Well, it means that the liver's inflamed and that you're hurting liver cells. We look for things in that situation. There's a lot of things that cause your liver to be damaged, such as viruses. Hepatitis A, B, and C are common ones.
Alcohol?
Alcohol's another one that we have problems with.
Does the liver regenerate if you've got bad liver tests? Does that mean if you get things taken care of, it may turn back to normal?
It does. One of the common ones that we're seeing now is liver disease due to obesity, due to fat infiltrating the liver.
That shocked me when I first started seeing there's a fatty liver from people being overweight. Does that damage the liver too?
It can. It can lead to cirrhosis and death, but with aggressive exercise and correct diet, you can completely reverse the process.
Mike, there's probably 50 other tests I could tell you about. We're out of time. Thank you so much for coming to the Dr. Bob Show. I'll remember those tests, re-record this show, make sure that we've got our CBC, that we've got our colonoscopy, that we've got our comprehensive profile, and we take our blood pressure. You're a great teacher. Thanks for coming to the Dr. Bob Show.
Glad to be here.
Are you getting the tests done that could save your life? Talk to your doctor about those. And now you're going to want to stay tuned. We're going to talk about the difference between dizziness and vertigo. Big difference, a lot of information for you. I want to thank Dr. Michael Bernard. Excellent discussion on tests that could save your life. Be sure that you and your doctor work out those tests. And now for questions from you, the viewer, that I think will be important to your health. Dr. Bob, is there a difference between vertigo and dizziness? Well, yes, there is. First of all, dizziness is not vertigo. When people say I have dizziness, they can be referring to two things. Number one, it could be lightheadedness. I just feel giddy. I just feel floating. I just don't feel solid. Something's wrong. That usually is not due to anything serious, although when you and I have a common cold and we jump out of bed, sometimes we feel lightheaded and giddy. That may be because our blood pressure is not balancing itself out. So lightheadedness and giddiness is far from vertigo. Vertigo is where the person is spinning around or where the room is spinning around, and really there's a loss of balance and you frequently have to grab for balance. It's a problem with the inner ear, with the semicircular canals, or it could be from part of the brain, the cerebellum. And so there is a central, and that's where we can have brain problems. The cerebellum is responsible for balance. If you stand straight up, put your feet together, and put your hands out, close your eyes, you won't know where you are. That's a kind of dizziness and imbalance. Vertigo, though, things are spinning around. Now, the doctor has to be sure if there is vertigo, things are spinning around with ringing in the ear and hearing loss. That's called Meniere's disease. That type of vertigo doesn't go away. It just stays there sometimes for 2 or 3 or 4 or 5 weeks. And if there's hearing loss and ringing in the ears, the doctor will have to make sure that there's not something like what we call an eighth nerve tumor, an acoustic neuroma. Most common cause would be benign positional vertigo. Many people have that. In a lifetime, 2.4% of the population will have benign positional vertigo. And that's usually short-lived. It may last only one day, it may last 7 days. And it's with sudden change in head movement. Lay down in bed, room spin around. Suddenly look over here, the room spins around. Now, when that happens, it's usually because of the semicircular canal, and there are little crystals that get in, most commonly, the posterior semicircular canal. And when that happens, people have vertigo when they suddenly change the position of their head. Now, what can be done about that? Do you need to be real nervous? Who do you see? Well, primary care physicians are very familiar with benign positional vertigo. There is a maneuver called an Epley maneuver, and that's where a physical therapist or a doctor or an ear, nose, and throat doctor can put your head through certain maneuvers, and that little floating crystal in the semicircular canal will move out of the canal, and bingo, that vertigo goes away. It's a wonderful feeling. Now, if it comes back more than once, then a physical therapist who specializes in this can teach you how to do the Epley maneuver, and they'll also give you exercises that will teach you how to handle moving the position of your head. So if you've got vertigo, be sure that if it's benign positional, that you still see your doctor. He can get it to go away. There are some medicines that you can take. They're antihistamine-like medicines. We call them meclizine or Antivert, and they sort of help the balance, but that Epley maneuver will make it go away. So if you've got that, you see your ENT doctor or your primary care doctor. That's all the time that we have for this show. I hope that you've enjoyed it as much as I have. Remember, we need to be exercising, and our exercise needs to be 30 minutes, 45 minutes, or 60 minutes a day. And if you can do it 7 days a week, it really will help you. How does it help you? Helps us lose our weight, helps lower our blood pressure, helps where type 2 diabetes goes away, helps where our blood pressure goes away. It takes away stress. You hear about a runner's high. Well, that's when we're exercising. Chemicals are put out in the brain that make us feel good. Start the day off with a good breakfast. Remember, our eating habits are why we're gaining weight in the United States. So eat more fruits and eat more vegetables. Start the day off with a breakfast: oatmeal, berries, fruits, banana, a good cereal, a small amount, only 1 cup of a cereal. And then for lunch, you can have a salad. Watch that salad bar. You can have some baked chicken or fish. Same thing for supper. Eat properly. Don't snack so much. Stay away from fried, fatty foods. Get 8 hours of sleep. Boy, will you feel good with 8 hours of sleep. And most of all, what do we want in the Dr. Bob Show? Well, it's that laughter in your life. Find somebody that you love. Tell some funny stories. Giggle a lot. Laugh a lot. And you'll stay healthy.